How to cure sciatica in 8 minutes or less right now. My name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic lower back pain and knee pain avoid a lifetime of painkillers and avoiding risky surgery. So sciatica usually starts in the base of the spine, so it's often associated with lower back pain and can cause shooting and severe pain down the legs or one leg at a time. Today, I'm going to show you exactly how you can get back to being more mobile by taking pressure off that sciatic nerve and getting you fit and mobile again. Let's get into it today. Let me show you this amazing trick. Okay, so you want to start on the floor. Doing it on a bed at home is going to be too squishy, so you need some good feedback on that area. So to start with, when we see people with sciatica, they are in a lot of discomfort and a lot of pain. So moving around from a sitting position to a standing position, back to a lying position can be extremely uncomfortable. So I want to walk you through exactly how you can do that comfortably at home. It's often worse in the mornings or at night, so people really struggle with sleep. So I want to show you these exercises to try and help. Now, you want to get on your front at home. So like this, I appreciate this is easier to do with me because I haven't got sciatica at the moment. So lying on your front like this is going to be one of the best positions you can be in. And I'm going to talk you through a step-by-step process as we walk through this. So head needs to be flat down like this. If you're arching your back up like that, it can often cause too much discomfort. Now, the most important thing is we're going to put a pillow underneath the legs here, and that's going to help to raise the back up like that. So we use, let me show you here. So I start with all these bolster cushions here, and the bolster cushion can come just on the top of the hips like this. That's going to help just to rotate the pelvis. It's going to take some pressure off your back. It's going to put it into more of an extension, okay? So we put it into more of an extension, that's taking pressure off of the disc, and the disc is something that can put it into, the disc is something that can press on the sciatic nerve. So like this, the idea is it's trying to lift everything up like that. So that might be enough to take a bit of pressure off, okay? So we actually use these blocks here. These are called SOT blocks, sacral occipital therapy blocks. Now, the blocks will come in at either side of the pelvis, so I don't recommend using these because you need to be diagnosed by a chiropractor first or someone that is trained in SOT therapy. But the blocks usually come in like this on the front of the pelvis, and they help to take pressure off of the disc and can relieve the sciatic nerve. So I'll just show you what we would do. We would do a couple of tests to identify which side we're going to put them in, and they would sit like this on the pelvis. And essentially that's going to put my pelvis in a different position. It's going to take a lot of pressure off. It even feels good just when I'm lying like this. So the concept I'm about to teach you is based off SOT. What we do is the client is flat like this, and we then start to move their legs like this. So if my right leg, this one here you see going down, if this one is the one that's getting interrupted with the sciatic nerve, what I'm really trying to do is take some pressure off that nerve. So you can move your leg out to the side like this, or get somebody at home just to take your leg and do it passively. Now when you move your leg, just let it go completely floppy, just relax off to the side like this. Now when that happens, it's going to take pressure off of the piriformis muscle and create some space for that sciatic nerve to start relaxing. You can then start to rotate your leg in, or get someone to do this passively and out like this, and that can take a lot of stress off there as well. Now, you're not going to have these blocks at home. These are quite big blocks. So what do I recommend? I've got a load of towels here. So this is probably about 1/2 foot high. We can get a couple of pillows as well. The thing with pillows is they tend to be more squishy and you're not gonna get as much resistance in there. So I tend to put a load of pillows down like this. And what I'm trying to do is get these just on my tummy here, just underneath my belt, okay? And I'm then trying to really stretch my back out. So you can see I'm getting more like rounded like this, okay? But it's causing my back to go into extension like that. So essentially what I can then do is then move my leg out to the side. I can then just let it flop off to the side like this. And even that just feels amazing. It feels like it's taking a lot of pressure off my back. It's feeling very, very comfortable in this area here. I can then start to try and get my leg lower like this to really help that pressure come off. And the leg can come back on. You can get someone at home to help you with that. And if you find this is beneficial, you can even put more towels in there to get more of a stretch through your back. The idea is that it's trying to just separate out the vertebra, trying to take pressure off that lower back with a load of weight, okay? So lying like this, again, can be very, very comfortable. Just letting that leg drop off to the side. Or what if you're getting pain on both legs? Well, in that case, you need to be more careful with which leg you're rolling out to the side. It may be that actually putting your leg out to the side is going to cause more pain. in which case don't do it. Just keep the legs nice and straight so you're in that one uniform position and it's not going to move from side to side. If you do find that putting one leg out gives you more relief, then obviously keep going with that as well. Really, really important, when you do finish doing the exercise, you want to make sure that you're pushing yourself up very gently. You're not rolling onto your side or causing too much rotation through the spine. Remember, most sciatic pain is caused from a disc, and your discs do not like twisting, especially twisting under load. So what that means is if you're putting force through your body or you're lifting something up and you're trying to twist and rotate, that's not going to be good for your back in the long run. So how long should you do that for? Well, I would say anything from 3 to 5 minutes. If you're finding that you've done 3 minutes, you've got up, you've walked around and it's actually fine and it's feeling really good, then I would go back to doing another 3 minutes. I wouldn't do more than say 5 minutes in that position, because sometimes it can cause more of a reflex relaxation of the muscles. And what I mean by that is they get too floppy, then it can cause them to quickly spasm up again. That can cause another spasm in the back, which we obviously don't want. So everything is very slow, very relaxed. If you're getting relief, then don't overdo it, but just keep making sure that you're using ice after using this exercise. Drinking lots of water as well will help. If you like the video, please hit the like button. Please subscribe to the channel for our regular updates. And you can grab copies of my best-selling books here: The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back. You can get them in the show notes below. I'll see you next time. Thank you.